Well, we're here with Dr. Vuong, a dentist from Federal Way in Washington. Is that the city where you're in, Dr. Vuong, Federal Way?
Yes, it is, Helmut. How are you doing?
I'm doing quite all right, Dr. Vuong. Dr. Vuong, tell us. We want to talk about dentistry today since that is what you do. And, as non-dentist people, as patients who have to go and, go to a dentist, on one hand, we believe different dentists are different. On the other hand, we kind of have that, mixed feeling of like, well, isn't everybody the same? A dentist is a dentist is a dentist. All you guys are licensed by the United States of America. So tell us a little bit about your philosophy, because probably that's what it boils down. Technically and scientifically, probably everybody is the same, but then there are probably different philosophies. Tell us a little bit about your philosophy and your practice. Maybe, Dr. Vuong, you could even tell us what makes a guy like you, any person, you anyway, become a dentist. Why did you become a dentist?
Well, I became a dentist because I enjoy working with my hands. I enjoyed science, and I enjoyed helping people. And all three of those things kind of combined to make the profession of dentistry unique. And I think I chose the right profession because I enjoy it a lot.
I've heard that a lot from people who like to work with their hands, and a little bit I understand it. I'm come from the mechanical field, so I understand a lot some of that stuff. But because dentistry is, yes, very, like many professions, by the way, that very, very scientific on one hand, and at the same time very artistic. There's lots of art in it. It's not just about exact doing the job for a crown or bridge or something right, but there's lots of feeling with it. Is that right?
That's definitely true. I mean, dentistry is more than just science. There's art is definitely a big part of it. Of course, there's the science part of how you're actually eliminating caries and any other oral diseases, but the artistry comes in actually perfecting the restorations and making them real lifelike, something that the patients can really see.
Good.
And
well,
appreciate. Yeah.
I'm sure your patients can be happy, whether they know it or not, that they have in front of them a dentist who does it because he likes it, because he liked it, not because his father said there's good money in it. So wonderful. Now, what's your philosophy in your practice? I mean, what type of patients do you see? Are you one of the guys who does lots of work under one roof? Are you a guy who believes in specializing and sends everything out? Not that one is better than the other one, it's just different.
No, at my office, we're more of a general practice, a family-oriented practice where we're seeing everybody from 6-month-olds to all the way up to 100-year-old.
I didn't know 6-month-old babies had teeth.
Yeah, that's when they first start to get their 2 baby teeth right down in the bottom incisor area. So we always encourage the parents to bring their kids in as soon as they start to get teeth, and we help them with the oral hygiene and how to take care of their kids.
It's probably all what it is at that moment, right? Educating the mom, and maybe even to get the baby used to be in that environment, so it kind of like grows up. Like back at home, we had a cat and a dog growing up next to each other, and they didn't know that they were supposed to fight because they grew up while they were babies together and playing with me, which I was a baby too. So we all 3 grew up together, not knowing that we're supposed to be different.
You're absolutely right. I mean, when kids and their parents come in at 6 months or even a year or 2 years, most of that time is spent educating the parents and how to take care of their kids, and so that we can help prevent cavities instead of actually having cavities, and we actually having to do work on their babies.
Right.
We'd like to spend more time preventing it.
Right. So what about other work, doctor? Like, are you doing periodontal disease yourself? Are you doing, implants? Are you doing, are you pulling teeth? Doing root canals? Are you doing dentures? Things like that. Is the answer to everything I just said a yes or not really?
Yeah. No. Absolutely. We try to do everything that we can in our office. The patients really appreciate actually having a one-stop shop and not having us send them everywhere from one office to another. Patients really enjoy being able to get all their dental work done in one office setting. And, we try our very best to be able to help them. And, every once in a while we do refer patients out, that have special cases that are just too difficult to treat in our office. But most of the time, I say 99% of the time, we get most everything done in our office. That goes from periodontal disease to wisdom teeth extractions to implants to just basic fillings and crown and bridges. We're kind of like a one-stop shop.
Great. All right. Well, wonderful. So we're going to be talking a little bit more about, specific procedures and why people might need them or not need them and stuff like that. And we're going to do that in another video. So thanks a lot so far, Dr. Vuong. Bye-bye.
Thank you very much.